You tuned in to Salam Media, and I will be touching on a very, very important topic right now. We woke up to the news that tomorrow, President Cyril Ramaphosa will be signing into law the NHI. First proposed in Parliament in August 2019. The NHI bill was introduced to Parliament, and it was set to direct the transformation of South Africa's healthcare system to achieve universal coverage for health services and to overcome inequalities of the past. And after so many years of waiting and a lot of speculation, and only a few weeks before the elections, it was announced that tomorrow President Cyril Ramaphosa will indeed finally sign into law the National Health Insurance Bill. And I will be speaking to Dr. Mvuyisi Mzugwa, who's the chairperson of SAMA, just to get a bit of insight on their thoughts on this, but most importantly, to give us a better understanding of what the NHI entails for you as a South African, whether you are a beneficiary of government's healthcare facilities, or you enjoy the privilege of having private healthcare. Dr. Mzugwa, thank you so much for joining us, and welcome into Salam Media.
Good afternoon to you and to your viewers or listeners, and thanks for having me.
First and foremost, I think, in South Africa, particularly when it comes to a lot of bills, bills like the NHI, the Bella bill and all kinds of other bills, there seems to be, a lot of criticism without people really reading what the proposed bill is all about and how it's going to affect them directly. And I think, the NHI is no exception to that. If you can, in the, most brief of fashion, just explain what the NHI entails. What is it, and how it will be affecting South Africans, both who are, receiving public healthcare and those who are enjoying the benefits of private healthcare?
Well, NHI is a pooling of funds. It's like a very big medical aid that is going to be rolled out by government to all South Africans who are working or not working, but also it will purchase services from the state and also from the private sector. So that is how it is envisaged. Whether it is a vehicle for that, it's another debate.
And the criticism, I think, mostly has been coming from medical practitioners. A lot of them, just echoing what you said there in your last sentence, saying it might not be the right vehicle, in making sure that everyone receives adequate quality healthcare. What's the criticism about? Why a lot of people criticizing the NHI when it looks on paper that it's for the people, it's making sure that the bridge and the gap is met between those that afford quality healthcare and those that can't, which is a debate in South Africa about equality. So why so much criticism for the NHI when we all agree that everyone deserves affordable quality healthcare in a democratic South Africa?
Well, the South African Medical Association really supports the objectives of the NHI, as it relates to what we call the universal health coverage. But now the problem is that we feel that the bill is not, the healthcare system in our country is really not ready, for the NHI, because NHI or universal health coverage, we're talking about, equitable access, to affordable healthcare system, where people are receiving quality healthcare without, further financial hardships. Now, in South Africa, the huge problem is that our system is not ready. One, in the rural areas, there are no clinics, there are no hospitals. We've got serious challenges in terms of the staffing of the system. There's shortages of doctors. You remember recently there have been protests where doctors have been making sit-ins in some of the provinces. But also there's issue of ethical governance and leadership in our state facilities, There is issue of corruption, as we have seen now recently with NSFAS. Those are the issues that we have raised with government, things that have not been adequately addressed, in as far as we are concerned. But also the issue of what we are raising, to say that NHI, it addresses only the finance aspect. There are many pillars in a healthcare system. Like I said, there's infrastructure, there's medicines and technology, there's issues of staffing, there's dire shortages of doctors and nurses, there's also issues of leadership and governance, like it was articulated by the former Ombuds, Professor William Makgoba, that we have a serious problem of governance and leadership. And like I said, there's other issues that have been sorted out. You can't deal with healthcare alone, ignoring issues of water and sanitation, like we have seen in Hammanskraal and many other issues. In the rural areas, as we speak now, there is no clean running water. This is something that was promised 30 years ago. It has not been achieved. If you can't achieve a simple water issue, how can you attend to a complex issue like healthcare, which I don't believe, as we speak, is going to be achievable under the NHI?
And I think, what a lot of people are concerned about is how the NHI will relate to private healthcare in South Africa. I think, the waters are still murky when it comes to that aspect. Tomorrow, the president is signing NHI into law. It's no longer a proposed bill. I have my medical aid. What does this mean for me going forward? What does this mean for someone paying their monthly medical aid rates and now having this NHI, signed into law? Are there any changes that are going to be in the private healthcare sector? What's the lay of the land going to look like after Wednesday?
The way that government has presented it, even though the president will be signing it into law, but the system will remain the same because there is nothing in place at the moment. It will be too premature to cancel your medical aid now because it will take perhaps more than 15 years to implement. So you just have to wait until everything is implemented, if that becomes a reality, because some of us are doubting that, because of the reasons we have stated already. So it is important that government has been promising that this is going to be in a phased manner. In other words, they start with primary healthcare, they will conduct clinics and doctors, who are GPs and stuff like that at primary healthcare level, and then they'll move on to hospitals. So you can imagine that is going to take time. And even that implementation at the primary healthcare level is going to depend if also, things are in place, because as we know it, many clinics don't have infrastructure, they don't have, they don't qualify in terms of the Office of the Healthcare Standards Compliance. There are many issues that have been identified. It will make it very difficult at the moment to just implement without capacitating those local facilities in the communities.
I'm sure, in the beginning stages, when the NHI was first, proposed, I'm certain, I'm not sure, but when, organizations like yourselves, as some, made part of, those discussions that, there's this thing that we plan to propose. This is how it's going to affect healthcare in the country. What are your thoughts on it? And those concerns that you're raising now, were they not raised in the initial phase, of the introduction of the NHI? And, what was government's, response to them? While you made them in the initial stages, because it seems, they've been totally ignored, and now we're in the implementation stages, although you are saying that it might take up to 15 years before we see, NHI fully into gear and, working in some way or not.
This is why we are disappointed, especially with the president, because we thought that the president was going to relook at the NHI with fresh eyes, because as the South African Medical Association and all other professionals, including the group of professionals that have come together, as the South African Health Professionals Collaboration, we have always voiced our concerns to government, right from the green paper, the white paper, and even made oral presentations to government. We've been working, trying to collaborate with government in terms of, coming up with a sound scientific bill. But that was not the case. As you know, some of the things that were pointed out was the failure of the pilot projects, as it relates to the NHI. So we've got a bill that is put in place, even policy that is being implemented, but there's no proof of concept. So this is a disappointment from our side. I must caution government again, because you'll recall that we have a serious disaster during the AIDS denialist era, when actually we pointed out some of the problems at that time, and many people died because people in government didn't listen to professionals. Now we're facing a similar approach wherein we're pointing out concerns and government is ignoring them. So we are worried that it could push our healthcare system to an unimaginable crisis.
Mm. And it's not a secret that on the 29th of this month we're going to the polls. The country will be voting. How much of that do you think has influenced the president's decision, the fact that we'll be going to the election soon and probably using the NHI as a proxy to try and garner votes? Do you think that had any kind of impact and influence on the fact that we'll be going to the elections?
Well, there's no doubt NHI is a political hot potato. People obviously are going to use it as we go to elections. You'll understand that most of political parties, including the ruling party, have no credibility. So they are going to use whatever they can, including healthcare, to try and sway voters towards them. So we are not surprised that it is at this point that people's attention are being drawn to the issue of the NHI, when actually we know that it's something that is not going to be implemented. In fact, we know of failures, of the state failing to protect South Africans. Like I pointed out earlier on, some of the examples like the NSFAS and stuff like that, and many of the failures that you see in the state-owned entities. So you can't expect much from this government. Even if they put it on paper, it's not going to be implemented.
How would you respond, to people that say criticism of the NHI is anti-poor, is anti-progressive, and is essentially anti-transformative and capitalist? There's a big private healthcare, insurance market in South Africa, and those that are fighting the NHI are essentially trying to make sure that business remains, untouched and undisturbed. And the poor, those that can't afford, remain with substandard healthcare, essentially.
Well, actually, the opposition to the NHI, or the concerns that are being raised around the NHI, are pro-poor. Because if you look, for example, during the times of COVID, the private sector was roped in to assist government. So we think the same approach can be used to assist this country, to deal with the ailing healthcare system. But also, when we point out unavailability of infrastructure in the rural areas, it is because we're concerned about the poor. So it can't be that, when we point out issues that are so obvious in the rural areas that there's no water, then the debate is termed anti-poor. So we do believe that our approach has considered the lives of South Africans wherever they are, unlike, what is happening now with government, they just want to use this, as their political football without considering the poor. They have never been pro-poor, even in the first place, because in the rural areas, there's no clean running water. So this is not a government that is pro-poor even in the first place.
And just lastly, a lot of sectors, including some political parties, business sectors, have threatened court action if the NHI bill is signed. Is some a part of those, that are saying we're going to make sure that this bill is not signed for now before government gets some of the basics right in public health care?
Surely Sama is prepared. We've been always prepared for this eventuality. We knew that at some point, especially close to the elections, this was going to be the case. It did not take us by surprise. Hence, we have prepared our legal team, to hit the road running after they signed the NHI into law. That will happen tomorrow. After tomorrow, we'll see, our legal team doing their job.
Okay, I think we're going to leave it there, Dr. Mzuka. Thank you so much for chatting to us. I'm sure, as the story continues and you guys follow through, with some of the actions that you have post NHI, we'll have you come back on the show just to give us the latest, but we're going to leave it here for now.
Thank you.
They have it there, Dr. Mvuyisi Mzukwa. He's the chairperson of the South African Medical Association, just giving us their thoughts and also just explaining what the NHI, which will be signed tomorrow by President Ramaphosa, will mean for you. Whether you enjoy the benefits of private healthcare or you are, in the mercy of, a very in disarray public healthcare. So I think it's going to be very, very interesting times going ahead. And I think the NHI is going to be a very contentious issue that us as South Africans are going to be facing from now till the future. We're going to take a quick break. When we come back, we'll continue with the show. You are tuned in to Salam Media, but it's sharp for now.